Wonderful. Hey.
All right, our meeting recording is starting. Whenever you'd like to get us started, Dr. Cooper.
Good afternoon, everyone, and welcome to the Health Equity Workgroup monthly meeting. And we would like to start off by everyone please introducing yourself in the chat. Please basically put your name, your organization, and the icebreaker. What is your favorite holiday tradition? Although I think Taylor mentioned she wanted to change that, but if you want to stick with it, that's fine. Or did you want to also say your holiday dish to expand it?
Whatever people are willing to share with us, I will gladly listen.
Wonderful. So please enter that information into the chat, and then we'll go ahead and get started.
Does anyone want to come off of mute and share before we jump into our agenda?
I guess I'll start. Visiting family and fellowshipping. So that's for me. And of course, I like the whole meal, turkey dressing, sweet potato pies, and all the other good fixing. It's all about the love.
Can go next for those who I have not met yet. My name is Taylor Palmer, and I'm with the Prince George's County Health Department, and I help manage our 4 work groups under our local health improvement coalition here in Prince George's County, also known as the Prince George's Health Action Coalition. So really excited to see everyone today, and thank you all again for your time that you've given us this year and continue to give us. And my favorite holiday tradition, every Friday after Thanksgiving, we always have a big breakfast, a big brunch. My family's a big breakfast family, so we always look forward to that after Turkey Day breakfast.
I will be the next. I'm Marlene Orantes from Hathaway Center from Health Literacy at the University of Maryland. And then my favorite dish for this holiday is turkey, mashed potato, and apple cider. I love it.
Marlene, you're new to the Center for Health Literacy, correct?
Yeah, you are correct.
Well, welcome. Congratulations.
Thank you. Dr. Bauer today is in a conference, and then I replace her right now. Yes. For this meeting.
Yes.
Well, welcome everyone. I'm Christine Stewart, co-chair and I'm with the Institute for Public Health Innovation. I put something differently in the chat, but if we're talking about holidays in general, I do love it's when I have a chance to see friends, family that are coming home, coming back to wherever it is that I am, if home isn't home for them. Holidays this time of year is when I see people I haven't seen all year. I love that.
Hi, I'll go next. This is Judy Lichty-Hess. I am with Health Quality Innovators, aka the Prevention Link program with the county. And I love stuffing muffins, which is something my son got me into, and that we make that together, and that's a whole lot of fun. He's informed me he made them with his fiance's family a couple weeks ago, and he put Italian sausage in, and he informed me, no, Mom, that's not good. I like the turkey that you do. So anyway, so that's that. Probably though, one of my favorite things about the holidays is just cooking for family and making the foods that they like.
Well, Judy, it's decided you get the first spread of the Health Equity Workgroup cookbook. We will dedicate that first section to those stuffing muffins.
You guys,
we had a question.
Yes.
What are stuffing muffins?
Yeah. No, it's a really easy. I first saw them on Rachel Ray years ago, and it's just making whatever stuffing mix that you like, and then we added she added some kind of meat. We added turkey sausage to it. And then you put it into a muffin container and just heat it up in the oven that way. It's super, super simple, but that way everybody gets crunchies. Because isn't part of what you like about stuffing is the crunchies? So if you put it in a muffin tin, and you can make them any kind of size that you want, but everybody then gets crunchies. So
That is brilliant.
you can make it vegetarian, you can make it, however you make the muffin, or the stuffing, you can do that. Just put it in a muffin tin.
I'm gonna try that. And I usually take my leftover stuffing and turn it into vegan meatballs.
Uh-huh. Well, yeah, very similar. No, that would be delicious. Absolutely. I love that idea.
I'm gonna try that. Thank you for that.
You're welcome.
And Dr. Cooper, you are on mute.
Welcome, Dr. Thomas. Thank you so much for joining us this afternoon.
I'm one of your groupies out here.
If you don't mind, please sign in on the chat, indicating your name, of course, we all know you, the organization, and your favorite holiday tradition or holiday meal, portion of the meal.
Will do.
Also wanted to welcome, I see Anya's joined us and Amber. Welcome, welcome. Thank you for joining us today. All right, and I can go over our agenda. So thank you all for continuing our introductions today. We will continue our discussion from our last meeting discussing the Health Equity Resource Inventory. So you all have probably noticed the bright and bubbly personality that is Ray Wallace joining us today. She is going to demo the test link for that resource inventory, give you all a walkthrough, give you a few updates, and then we will open it up for any comments. But we heard you all in our last call, and we do want to give you all that link to take a look at on your end and be able to sit with it and go at your own leisure and review it. So we will leave you all with that this afternoon, hopefully give you some time back in your very busy day. And then we will wrap up as usual with our community announcements and adjourn for the afternoon. All right, can I get someone to read our vision statement?
Yes, so thank you, Taylor. So this work group, our vision really is for Prince George's County to be a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender identity, or health literacy skills.
You're Christine. All right, so as I mentioned, I am going to pass it over to Ray to walk us through that testing link. But again, just want everyone to be grounded in our ask for the group is going to be in the next few weeks to submit feedback. And again, you will all have access to Ray's link, so you'll be able to take a look at it at your own time. So I will go ahead and stop sharing on my end if you are ready to share with us, Ray.
Sure. Let's just make sure you're seeing the right one. One moment. Let's try one more time. Stop sharing. Screen. All right, so one of these days it's going to open up in the right screen. One more time. Third time's a charm.
What happens to me? It ends up in my sock drawer. That's get your sock drawer.
Okay, we're in. All right. So we do have the testing link live. Can everyone see my screen?
We can.
Okay,
Yes.
great. So a few things that we added since the last time we spoke about, we did we added pictures to break up the different sections. We had a bit more vocabulary, so we've added that for the first module, so that's all been updated. All the vocabulary has also been alphabetized. Not much has changed in terms of the actual modules for each section. Each of them are there. So I'm just giving you a quick scroll through to see each of the different sections. One of the other things that we changed, or we were able to change, originally when you would click on one of the modules, it would take you to a page. I'll click on this one. Oh, that's a direct link. One moment, let me get a different one. Okay, so before the update, this information right here, which was what clicked through, was much smaller than the related content. So it was making it appear as if the related content was more important than the actual information from the resource library. So we were able to fix that and make this the primary focus of each page. And then to view or download the resource, you just simply click the link. So that was one of the major changes we had to do on the back end. So all of those pieces are up and running. As Taylor mentioned, we will have a version, a testing link to share with you all after the meeting. And I know she'll also go through the how we're going to be collecting that information as well. The only other piece that we will be sharing with you after we've made the edits will be how to add additional resources to the resource library. So that will be an email that you will, and of course, this will all be in writing and we'll get it all over to you. But just so you know, it'll be an email to myself and to the PGHAC email with the information that we'll be sharing with you later. So that would be it for me. Is there anything else I need to touch on, Taylor?
I just wanted to give 2 updates for folks. I know in our last meeting, folks asked about the dates, the added or updated dates. Ray, I believe you said that there was some challenges with deleting that information.
Yes. So when we delete anything from the resource library, it affects every single resource library on our site and the information that gets pulled when we when you're looking into the indicators on our data on the data end of the site. So it'd be difficult to remove it altogether, but they're working on a couple data change, back-end changes on our site. So it's still something I'm working on. So needless to say, they have to do a little they have to do a little bit of HTML work on the back end to make that work, to figure out if it's even doable. So they're working on it. In the interim, still working on that. So I will let you all know in the next meeting whether or not they've been able to find a workaround for that.
Now, just wanted.
Couldn't you just archive it? Instead of actually deleting the information, just move it, create an archive section and just throw it into the archive?
Well, how does the archive, we can automatically, that was the piece I wanted to mention. So we can add in an expiration date. So it naturally rolls off of the site. If there is something like a press release or something like that needs to get rolled off of the site. So it's helpful to have that information there because it'll automatically do it. For those, there are items that don't need a date at all, but it is a mandatory field. So that's the part we're trying to work around, getting that date out of it completely. So yes, when it rolls off, when it becomes expired or when it moves off of the resource library, it is archived. So we won't lose the information.
I'm shaking my head, yes, but you can't see me.
Okay, I felt the nod. And was there another piece you mentioned, Taylor, as well?
Oh, and then just emphasizing, Ray, you showed us how, making that information larger when you actually click on the resource. So I just wanted to clarify with folks that, under the limitations of the structure that we're working up with our website, that information has to remain, but Ray tried to troubleshoot that and just make the information larger so it's a little bit more readable and brings a little bit more attention to those resources. So just wanted to call that information out for anyone who's taking a look at the link right now.
Nice.
And I
And-
realize since we do have some folks that are not, oh, so go ahead.
Christine, I think we're on the same wavelength. I was going to give really quick context to those who are joining us today. So with this Champions Resource Inventory, and please feel free to fill in gaps, the audience of focus are Prince George's County community members. We are trying to empower individuals to learn more about health and all policies. So that was kind of the central idea of this training, and recognizing that when we are trying to build health and all policies capacity, we also need to address the foundations of health equity and equity principles. And so you'll see on that first module that really lays the groundwork in establishing those shared definitions, the values that this work group really stands on and promotes itself in. And then it builds up to talk about health literacy. That was another important component. We talk a lot about health equity and the health information that you receive. We highlight a lot of the great work that the Horowitz Center for Health Literacy has done. We take a look at organizational health literacy, differentiating that versus personal health literacy, and really wanting to call out advocacy efforts to hold organizations accountable for their health equity measures versus always putting the onus on the individual for the expectation for the literacy to be at the individual level. We have the culminating module 3 that really highlights that advocacy piece, that civic engagement. So this is where, again, we bring in information about health and all policy. We really try to ground it in specific Prince George's County resources. So we want folks to, get to visit different reports that exist, Plan 2035 that outlines a little bit more about health and all policies, and then end with this call to action that includes locating your council member, being able to take a look at different documents, different templates that exist for engaging political figures in local and state government. So we hope that will be kind of a way to direct people from start to finish, that they're able to have that groundwork and then work their way through the modules, and really just meeting people at where they're at in this spectrum of health equity, health and all policies, and just overall increasing civic engagement in Prince George's County. What did I miss from that brief context?
Don't we have a component in which community members can also add information that's going to add value to opening up access, engagement, and participation and so forth?
Yeah, so that will be something. So Ray discussed, she has created some questions for us all to pilot as a work group. And so what we can do is we can take a look at those questions, see the questions that we're asking. If we want to pilot that as a work group and then expand it to the community. And so then we'll have kind of those bi-directional feedback loops. So this can, again, be something that we can pay attention to be able to see, what are people clicking on? What are people interested in seeing more? And then we can ask those specific questions about what would they want to see added and what value does this add to them?
Yeah, and thank you for asking that question, because I did want to raise, I think that was something that we did discuss several meetings back. But yeah, I don't think we came back to it. I think that would be really valuable information to be able to collect. So we have an understanding of what people are interested in getting out of this, so we can help inform the later Health Equity Champions curriculum.
Yes. So what I can do is I will add a question to that Google form that I have in the chat. And I will ask if anyone has any specific questions that they would want to be able to ask the community to, again, build those bi-directional feedback loops. We will be able to take that feedback and start creating an assessment tool.
And I also think it's important that we understand that this is an iterative process. So it's dynamic. It's, so just as our needs change, our communities, their needs change. So this is going to be ongoing. So I again, want everyone to feel comfortable in providing whatever input and feedback so that we can best fulfill those obligations to individuals that are most vulnerable. And those are the people who are going to need it the most.
And speaking on that piece as well, we're also making our web provider better, because with all of the changes that they've had to make on the back end for us, they are planning to make this into a larger sweep across a lot of their products. So we're not just helping us, we're helping a lot of other people in the long run too. I just wanted to share that.
No, that's great to hear, because I know there are lay residents who are out there who are interested in being able to access this. So the better we can put ourselves in their shoes as well, figure out, like, because there are people that are interested. It would be great if it was easily accessible. So kudos to you, Ray, for all the work that you've done. I'm glad to see that this work has helped to translate to some other website improvements.
Yes, and they do a lot of work with coalitions similar to us, and so seeing not even just the training modules, they got excited about that, but ensuring that we could alphabetize things, like things as simple as that, and that goes alongside with certain things in health literacy, and make sure it's easy to scan documents that people can find it. So within our own work, we want to make sure that we're reflecting what we're telling people that they need to do in order to be to ensure that the information is getting to those who need it in a way that they can receive it. And this has been really fun. So thank you all for letting me work on this with you all too.
Thank you, Ray. It has been an absolute pleasure. While we still have Ray on the line, does anyone have any specific questions or any comments that they would like to share?
My comment, because I haven't been here in a bit, I hope I'm still on, is that you did all this work and you found it to be fun. I just love your energy, and that this space is still the solution space. You have not lost your spirit. The election's over. We know the 4 years ahead. You're not sanitizing the language. We are Maryland, and the country's looking for models like us. So thank you for keeping this going. And do not back down. We are on the right path. And now it's quite clear what we need to do. There should be no ambiguity. And that health equity is not going to get weaponized as a term. We're not going to leave it. We're not going to throw it aside. We're not going to sanitize. And we're going to show what we can do right here in the great state of Maryland. People are looking for places to come. Trust me.
They are. And
so thank you.
It. Of course. So thank you.
And just to add to your point, Dr. Thomas, other states are looking at this state as a model state. Yeah. So this is our, way to showcase what we're doing and what actionable steps that we're taking in order to address those gaps that exist in all areas of social determinants of health, whether it's food insecurity, housing, healthcare. This is just a broad, comprehensive approach.
So be ready for the haters, because we have leadership in our state that are racial and ethnic minorities, and anything that goes wrong will just be blamed. Mm-hmm. But let's make it all go right. Let's throw that strategy as well. So I'm just so excited to see the spirit still in this space. Thank you.
Thank you for those uplifting comments, Dr. Thomas. And I think something that you mentioned is I think we need to underscore, just because our leadership may look like some of the community doesn't mean there isn't still work to be done. I think that does get lost sometimes, especially in our county. Especially as we are diversifying, I think the makeup of the county is changing as well. So I think this work is still and always has been really important. It was hopeful to have an uplifting call after this month. This month's been heavy. I'm sure it's been heavy for many of us for many different reasons.
Well, a lot of
in this space.
A lot of people are burnt out, but the treatment for burnout is do something, and that's what's happening here.
Well, I'm really excited to be able to publish this when we're ready and to see all of the additional feedback coming through so we can see all of the hard work from everybody on our team get to that published stage to see it in finality. Now, like we mentioned, this will be an evolving document, an evolving resource. So the beginning, so we'll be at the beginning start of the journey of sharing it. So I'm looking forward to all of that feedback. I'll get it updated as soon as possible, so we will be ready to share it with all of those interested and excited, hopefully early in the new year. I think, Taylor, is that what we were saying?
Yes, thank you, Ray, so very much. And to quote Dr. Thomas, thank you all for being in the solution space and for having this additional resource to be able to equip the community with a way to hold leadership accountable and to equip them with the knowledge to be able to do so. And so I certainly, look forward to seeing this final product, getting to announce it, to shout it from the rooftops that this has been something that has been a long time coming for this work group, and you are all owed just this big success to get to add to your resume. So I thank everyone on this call who has been on this journey for varying time, but has stuck it out and who is continuing to do great work in this space and in all of your spaces. So I've posted in the chat here the link to that testing link as well as that survey. Please, give whatever feedback you can. If you want to add something, I know Dr. Powell offered some great suggestions in our last meeting, and we were able to add some definitions there to hopefully ground that module 1 and some really great definitions. Please take a look at, I know module 2 was a module that folks had feedback on, especially the title. We didn't land on a title in our last meeting, but if folks have any ideas for a more representative title for any of the modules, or again, any resources that they want to add, please feel free to do so in that Google form. It also has my email attached to the Google form, so email me if you have any questions at all or want to meet specifically about this. And yes, to Sharon's comment, let's plan to celebrate the publication and disseminate its availability through various channels, certainly.
And maybe that's something, that's a very good point, because we could do all the work in the world. But if it doesn't get out there, so maybe that's in advance of that, that's something that we can talk about, touch base on with the next work group. And Dr. Cooper, maybe that's something like we plan, just do some preliminary thinking about with Taylor in our next planning meeting, because I would hate to see all this work we've done and it doesn't go wide.
I love that, and I'll work with Taylor too to give any additional guidance or help I can give as we shape that marketing dissemination plan. So excited for that. So yeah, we'll get it in a great spot, and then I'll start working with Taylor on some marketing ideas, and then we can all get together and flush all of the rest of them out. So thank you all so much, and happy Thanksgiving if I don't see you all before then.
You as well. Thank you so much. Tremendous work. You are amazing.
Thank you so much, you all. Like, my cheeks are hurting today. I really appreciate it. And take care.
Thank you. Enjoy your stuff and
sunshine.
Gonna try those stuff.
Definite energy.
Good.
And
Try those
spirit
stuff
that's
and
needed.
muffins. I want to know how they turn out.
Oh, I will be in the chat the next meeting, letting you know exactly. And I will take some pictures as well for evidence.
Please do. Please do.
I think I may try it as well. Quite honestly, when you mentioned sausage, I was really concerned because I did not have actual stuffing in my mind. I was thinking about sausage and a blueberry muffin, and I was like, let me Google.
No.
I got it now. Now I get it.
Yeah, do your
Good.
version of the Food Network. Get your phone out and send us a little reel of you cooking right in the kitchen.
The stakes get higher. All right, take care, everyone.
Thanks, Ray.
Bye-bye.
Alrighty. Well, as I mentioned, please continue to provide that feedback. And ahead of our next meeting, everyone on the call, I see a few folks from the health department. I see some folks, some hospital partners. So I'm thinking, if everyone can think about their professional and their personal networks, if you're a part of any groups, who have access to Prince George's County residents, please do think of those folks and think through some channels that we can send this information out to, and just get it in the hands of as many Prince George's County residents at all different levels and all different interactions that you have professionally and personally. And we will start to gather that information in our next meeting. And Christine, yes, feel free to submit many responses. If you take a look at module 1 and want a break, please do feel free to do so. There are no limits. And then also feel free to add as much information to those open paragraphs. They should allow for long responses, so feel free to add as much information as you need. Any questions or any comments? Okay, and I will send out all of this information, but again, same information that I just went through, and we will work on creating those documents for how we go about updating. I know in our last call, we also talked about doing some quarterly updates, taking a look at the data, and so we will start to put together some of those plans and bring it up to you all and see if we can create any consensus around that, and then have some well-documented forms that inform others who wish to join the work group about our process and where they can join in at. So we will keep you all updated in our future meetings on those efforts. Alrighty, well, I'm going to go ahead and move us into the community announcements, unless anyone else has anything else they would like to add. All right, well, first up, I am going to go ahead and call on Sharon, if you would like to share about this exciting opportunity to engage with the Patient Family Caregiver Advisory Group.
Yes, so the Regional Primary Care Coalition is working in collaboration with the Primary Care Coalition of Montgomery County. There are so many primary care coalitions, but we're working on a 5-year project that's funded by the state health department, looking at how to improve services to pregnant people and postpartum people. And part of the project, the bulk of the project is going to be working with providers and hospitals to ensure that there are forms that they need to complete when somebody is newly pregnant and when they're discharged. So those forms are used, even though one of them is mandatory, they're used inconsistently kind of throughout the state. And this is a statewide project. But what we're looking for is to put together, what I'm specifically looking for is to put together a patient family caregiver advisory group, because if we're looking at areas for improvement, we really need to have the input of people who have been pregnant, recently pregnant, who are pregnant or are recently pregnant, to be able to tell us how to best impact the system. And I want to make a pitch for ensuring that we get good Prince George's County representation, because the advisory group will have folks from across Maryland. But I think, if we look at data, that Prince George's County has some devastating statistics around maternal morbidity and mortality, and so we really want to ensure that the up and addressed throughout the course of this project. People can participate whether or not they speak English. There will be accommodations for other languages, and we also have this flyer in Spanish. The person doing the initial interview and screening is Grace Townsend. She's the project director for the whole project. So, and her information is listed here on the form. So please distribute this to people who are providing services to pregnant and postpartum women or people, and if you have any questions, please feel free to contact me directly. I can tell you more about the project and what we hope to achieve over 5 years. That's all.
Sharon, do you know if this is Judy, and hi.
Hi.
Do you know if anybody's working with the Maryland PQC, Prenatal Quality Committee?
I do not know if anybody's working with the Maryland PQC.
PQC. I recommend they do, because they've talked about some of these advisory committee things with that PQC, and I can put you in contact with the lead for that if you'd like.
Yes, that would be great. And I'm going to put my email. Actually, I'm putting my email in the chat for anybody who has questions about this. You can email me. And I'm happy to talk about it more. I just feel like, finally we're getting attention on maternal and child health here, and we need to take advantage of it while we have it, right?
Yeah, exactly. I mean, they're working with FQs and all sorts of different organizations across the state, so that it may be nice for you to have a conversation with somebody from there.
Well, it would be, and we're working already. We've selected 2 FQHCs within Prince George's County, and 2 of the hospitals within Prince George's County who are going to be part of the initial cohort in this project. So yes, I would definitely want to reach out and connect.
Yeah, I can definitely put you in connect. Put your email. Oh, there it is. And I will send an email to you and Katie. Okay.
That's great. Thank you.
You're welcome.
I'm just including those flyers in the chat. The permissions, because of course Teams does not want to cooperate today, but and I will also include these in our meeting minutes.
And I have to say, it's really hard to think about a pregnant person or somebody who's just delivered and has an infant getting folks to participate. So, but there may be people who want to share and know that it's important to share their experiences.
Hi, Sharon. Do you know, or do you feel comfortable in naming the hospitals that are currently participating?
Southern MedStar, Southern Maryland Hospital is participating, and is the other one.
Great. Yeah, I was going to ask about because I'm on their community advisory board. I was going to pitch this to them, but it looks like they're already on board, so that's a good thing.
Well, they're on board, but they could use a shove.
Okay. I'll be reaching out to them.
Yeah, it took us a little bit to be able to recruit folks. It's adding, for the line staff, it's like adding one more piece of work for folks to do. And there's a whole lot of process improvement work that goes with this. So,
absolutely.
In order to get the benefit, it is going to take some work. So anyway, yes, I would appreciate if you pushed a little.
I'll be in touch with them. Most definitely.
Thank you.
Alrighty, any additional questions or thoughts for sharing out the flyer? All right, well, thank you very much, Sharon. Please do keep us informed with how we can help out with this initiative, and excited to hear it take off.
That's great. Thank you so much. I appreciate the opportunity to share this with you all.
Absolutely. All right, and next, our friends over at the Institute for Public Health Innovation, IPHI, is having a webinar on preventing gun violence for healthier communities. It is taking place on Thursday, December 5th from noon to 1:30 p.m. So I have included that link in the chat, and I will be sure to also include it in the meeting notes that will go out. Anyone who is interested, it is a free training. I have included the link, so that link will probably take you to a screen that shows all of your trainings, but you are able to take a look at all of their offerings as well. They have many great free trainings available, so please feel free to utilize any of those trainings or webinars. And then next, a request coming from the Prince George's County Health Department in our Office of Assessment and Planning. As you all know, our community health assessment process is well underway. The next step in collecting the community's feedback includes the community input survey. We have been hard at work getting that survey put together, informed by our 2022 community input survey, making some updates that we saw from the state that they implemented in their state health improvement plan that they had in their community input survey. But we want to also open it up to you all to give us feedback on the survey. Again, we want to make the community health assessment as representative of Prince George's County, of all of the health needs and assets that we have across the county. And we want to make sure that these questions are reflective as such. So please do feel free to take a look at that link. The Google link here will take you to the survey. You can take a look at all of the questions that we've drafted up thus far. And then we also have another link here at the bottom that will ask you for any organizations or any community partners that we should include in our dissemination plan. Again, this is an effort. We want to make sure that we are getting it in the hands of as many Prince George's County residents as possible. And so we want to make sure that we don't leave out any groups or any community members. So please do feel free to include any information that we could use to get this survey out. And we are asking for feedback when we come back from the break on Wednesday, December 4th. So again, please do let me know if you have any specific questions about the survey. Happy to chat with you all more in depth about the community health process, the community health assessment process, if anyone has questions. But again, just wanted to bring this to everyone's attention. Any questions regarding the community input survey? All right. All right. Well, lastly, before we adjourn for the afternoon, I wanted to also extend this invite for our quarterly coalition meeting. So the Prince George's Health Action Coalition, who you are all a part of, the larger umbrella. We are having our in-person quarterly meeting on Tuesday, December 10th from 6 to 7:30 p.m. This will be an in-person meeting taking place at the Parks and Recreation Administration building. All are welcome, so please do share this with your networks. We would love to have some community members also present, as well as our work group members. This will be a year-end celebration of all of the hard work that you've all put forward, and being able to share some exciting announcements, share those year-end successes and our plans for 2025. So we would love to see you all. Please do feel free to use this QR code. You can scan this QR code, or I've put a link in the chat, and I will of course share a link with you all in the meeting notes. You will be able to register and pick out your meal for the evening. So again, all are welcome. We would love to have you. All right, well, I will go ahead and open it up for any additional community announcements. Does anyone have anything that they would like to share? Anything going on before the end of the year? Any community events or any announcements?
We all
Alrighty.
just racing to finish deliverables.
That's how it usually goes.
And people are probably cramming in as many meetings as possible, if I know how things typically work at this time of year.
Well, continue to let us know how we can support you all. If you all have any updates that you'd like to share out, we have our PGHAC newsletter, and we also have our work group contacts. So happy to send out any information on your behalf. So just let us know. But otherwise, we hope to see you at the in-person quarterly meeting. And if not, we will see you next month on Thursday, December 19th at our usual 3 p.m.
Thank you all.
Thank
Thank
you.
you.
Happy
Thank you, everyone.
Thanksgiving, everyone.
Thank you. Bye-bye.
Bye-bye.